and community outreach to improve health and wellness in the DMV nationally and sometimes internationally. Today's facilitators are Misha Kogan, MD, founder and executive director of AIM Health Institute, and medical director of the GW Center for Integrative Medicine. He will be joined by Reiki Master Teacher Luann Jacobs, who is a member of the AIM Advisory Board and a wonderful contributor to our weekly gatherings. Luann is going to do some mind-body exercises to help us with grief. And with that, I'll turn things over to Misha.
Thank you, Janet. Hi, everybody. I have lots of updates. I don't have a one big theme for today. And to keep a from bad to good strategy, I will start with bad updates. And the title of today's presentation is Wear It or You May Regret It. Those are the quote from Chris Christie, who barely survived recent infection. And what's really interesting is that he publicly kind of denounced what was going on at White House just today, I think, and basically feels very sorry that he wasn't wearing any protective equipment during his debate prep with Donald Trump, as well as the meeting for the judge nomination. So, you know, it's just the underlying, the importance, wear the mask. So, okay. So the bad updates, today is yesterday, sorry, fourth highest day on record with over 70,000 new cases. The daily deaths are still around 1,000 per day, but we're probably going to see a 15 to 20% increase within a week or two as the total number of new cases rising. Some really bad news, if you're in Wisconsin, there are no more hospital beds in the whole state. They're opening additional field hospitals. We're at 222,000 deaths around or so. And so if nothing changes, we're going to have over 300,000 deaths by the end of the year. So it's a pretty scary numbers. The mortality, by my math, don't quote me on that, stays at around 2.75%. That's just simply doing the math of taking over 200,000 deaths divided by nearly 9 million cases so far. So the only two states where there are improvements, Oregon and Hawaii. So all other states we see an increase or a flat. So DC is flat, Maryland is slowly, and Maryland and Virginia are slowly increasing, but we're still doing reasonably okay, at least in our own local area where the team is of organizing this event today. Okay, so vaccines update. It does seems like the Pfizer is now taking the lead with their vaccine data, probably going to be first out of the gate, and in part because both AstraZeneca and Johnson & Johnson vaccines are on hold. Trials are on hold in US due to complications, neurologic complication in AstraZeneca and death in Johnson & Johnson trial. They're not releasing data as to what the Johnson & Johnson death referred to. There's no claim whether it's vaccine related or placebo related, totally unrelated. So of course that creates all kinds of, concerns in the public, lots of anti-vaxxers messages that I'm seeing on my Facebook. But, just to sort of put a little bit of a dump on this is the fact that the protocols are followed. That's a really important message. Vaccine trials are very frequently halted due to exactly these types of issues. If there's any complication that occurs, the typically trial gets halted until there's a clarification whether the complication has anything to do with the vaccine, because obviously they need to unblind the participant with a complication and also investigate it. Until that's finished, it's very common for trial to be halted. So I actually see these things not necessarily as something really horribly negative until, of course, we get the data, but as the protocols are followed message, which is okay. And of course, there's a major update about Britain, very controversial trial of inoculating vaccinated patients with live virus. I'm not going to comment on that. I'm actually going to take a stand of neutrality here because I'm not a vaccine researcher, it's hard for me to say whether that's justified at the moment or not. So, you know, with that, I'm going to move on. So the exposure notification system, some of you, those of you who are somehow either work in DC or live in DC, probably have gotten a message on your phone. So let's see if I can share the screen. So if you have gotten the message from DC government, you've gotten it from this website. So this is DC COVID alert notice. So you can sign up, and there's a description how you would do that in the multiple steps. So there's step one, whether you have an Android or iPhone, you have to get the app from either a Google Play or from iPhone Store. Then there's an activation of the, so basically bottom line, what they're doing is this: your phone is continuously being monitored, your location via the Wi-Fi or Bluetooth rather is continuously sent to the centralized system that cross-checks it versus cases of people who are known to test positive. And then if you came into a close contact, I'm not sure how they defined it as to what the different distance is, then you'll get a notice that you have been exposed. So of course, this raises multitudes of questions. You know, are they going to be effectively using this technology? Of course, everybody monitored, your phone is tracked, etc. But you know, it appears like a major development because it gives us a possibility of a real-time tracking of whether we're exposed or not when we don't know it. I mean, obviously, if you know you're exposed to someone, you know it. But if you don't, there's the system, and if a lot of people participate in it, it can be an extremely effective tool. So I'm going to closely follow this. Since we don't know reliability, accuracy in any of this, you know, I think it's something that just started, and I actually applaud to our state of DC. I have not seen anything like this in Maryland. Okay, so pharmacological update, not a good update. So remdesivir, on one hand, has been just approved formally by FDA. So what that means is that remdesivir, of course, has been emergently authorized through a special mechanism. But Feds just approved it formally through a standard mechanism for the COVID. The problem is that WHO earlier this month claimed that the drug does not work, it does not decrease mortality, and it does not reduce the hospital stay. Formal WHO statement, which you can find on their website, basically states that all the trial data has been very disappointing, and they don't recommend for any countries to effectively utilize it. So this is quite sort of surprise. You could think of, although I don't, for me, that's not a surprise because I reviewed at least US data and the data from the US data from the maker. And the data does sound, at least, I mean, it sounds like it's statistically significant, but clinically barely relevant. I think that's what the WHO is trying to say. So, you know, it's the only formally approved drug by FDA for the COVID specifically. However, even that approved drug doesn't seem like it's giving us a whole lot. So just with that. All right, and then I have a natural updates. There are two of them, okay? So the first one has something to do with one of my favorite topics, and that's beekeeping. So I decided to, in detail, tell you about propolis. So first of all, let me show you what that is, because I'm assuming not everybody knows what propolis is. One second, I'm going to pull up a photo. So if everybody's seeing my screen? Okay, all right. So what you're seeing here is a side of the beehive with some bees crawling around, and this really kind of dark brown material right here that looks like a glue. And if you ever worked with a hive, when you're trying to pry open boxes between themselves, that's what gives beekeepers the nightmares of their daily existence, because it's literally a main material that bees are using to seal any holes in a hive, to glue things together. It's a very thick resinous material that's over time completely dries up and becomes like a I guess the best I can think of, if you look at the tree and the sap is dropping and eventually it gets kind of hard, that's kind of close consistency. If you take a little piece of this and you try to taste it, it's very, it sticks to your teeth. It colors everything this very bright yellow color just above right here. And, you know, it's really hard to wash it off the clothing. And the reason I decided to talk about this, there are very few natural universal antimicrobials, and this happened to be one. It's probably one of the most potent one that we have. It's been studied in thousands of clinical trials, nothing really majorly large, nothing heavily randomized. So there's not a lot of clinical trials to sort of say, yes, it's very effective for something, but basic research on propolis has been done over many decades, and recently there has been several lab studies showing a very profound anti-COVID properties. In fact, this substance, the propolis, have been tested against pretty much all existing viruses, and there hasn't been a single virus yet that hasn't positively responded. Now, of course, or positively meaning being the division of the virus being blocked. The mechanism of action is not exactly clear, but it's an inhibition of replication of any virus. How that's happening, we don't know. Why is it also antifungal and antimicrobial? Also not exactly clear, but it's a very complex substance. It's a byproduct of bees' metabolism from the food. So it's literally, I'm not kidding, it's a bee's poop. So it's their poop. But it's a poop that made in a certain way. Bees also poop, not propolis, there's other poop, but it comes out from the other end, and it's enriched by certain metabolic activity by the bees to make this material. So it is plant-derived in essence, and it's extremely concentrated plant-derived material. So where am I going with all this? Well, I mean, you can actually obtain this material either from a local beekeeper, yours truly, although my propolis doesn't look very presentable, I wouldn't recommend it. It looks just like pieces like that. I tried all kinds of iterations of it. I tried crushing it, freezing it, putting it in a high alcohol tinctures. I'm a total failure when it comes to a manufacturing process. But you can buy it. I'm just going to show you, you know, in terms of the tincture. So you can buy it something like this. I have no relationship, it's just first image that comes up. So you can buy it in a liquid alcohol form at relatively inexpensive. And, you know, in the past, pre-COVID, what I was often suggesting to people is that they, when they're using their neti pot, that they would put a couple of drops of propolis straight into the solution that they use for nasal wash. And you know, and do it on a regular basis. If you only use a couple of drops per day, it becomes super cheap because one vial for $10, $15 will last you for a year or so. And it's extremely stable material, alcohol or no alcohol. I have some propolis I'm still using from 5 or 6 years ago. It still has a strong smell and very active. But you know, we don't really know beyond that whether there is a specific efficacy. But you know, it seems to be quite safe. If you're can somebody mute, because there's a lot of background noise. So if you like the honey and you consume it, one really easy way to get propolis in is to simply add propolis into the honey every time, just a couple of drops that you're using. That's actually, you know, when I use my own honey unfiltered, I on purpose try to make sure that my filtering system is very crude. So everything kind of, even tiny pieces of propolis go through the filter. And, you know, unfortunately, the commercial honey, you're never going to get any propolis in it because they not only filter it out mechanically the way I do, but they also heat it. And when they heat it, they first take away the more liquid fraction of the honey, and that excludes entire propolis. Propolis is a lot heavier than the honey, and it very quickly can be separated by any heating method from the regular honey. What you know as Manuka honey that is thought to be miraculous, I'm putting this in quotes because I don't believe any of this. I think it's all a bunch of commercial BS, to be honest with you. It's not any better than most really high quality honey, no matter what the studies are showing, because I've done my research and it's very clear to me that it's a commercial hype nothing else. The Manuka honey should cost just the same as every other honey, not more, not less. It's just a very high quality honey. In fact, there are clearly some honeys that are a lot better. But bottom line, one thing that occurs with Manuka honey, they don't really filter the propolis, and the way the, I guess the plants are in New Zealand, the content of propolis in Manuka is higher, and the protein concentrates in that honey is higher. So we think of that as a high quality, but that's only because the typical honey in America is just garbage. So if you're buying a commercial honey in US from a non-local beekeeper, I'd say 90% chance you get garbage, no matter where you got this. Whole Foods, even with the labels organic, that doesn't mean anything. If the honey was heated and filtered after that and homogenized, then it's probably not good. And, you know, I can't say 100% sure, but so that's one interesting update. The second is there's a newer, smaller study saying that combination of quercetin of about 1 gram and vitamin C of 1 gram seems to be more effective against COVID in a small, in vitro, so preclinical trial than either molecule alone. So we already covered both quercetin and vitamin C as possible, very good adjunctive prophylactic or preventative rather treatment. It seems like when you combine those two, they may be more potent, but that's too small of a study. I just thought I'll bring it up. So with that, I'm at the 20-minute mark. So let's try to take 5 minutes. I have not been paying attention to questions at all because I had all this updates. So I'm gonna go screen the questions and see what I can answer. People who send me lots of private questions, I'll do my best at some point, but don't anticipate answers right now. All right. Thank you, Cecile, for your personal research on the senior flu. Everybody can read that in the chat. Looks like there are some pharmacies that carry Fluad in the past. But so Fluzone, I don't recommend. Fluzone is a vaccine from last year. GW decided against it due to the problems last year, and they felt that this year Fluad is better. So I'm just a little update there. The spelling is in Cecile's note, and again, thank you. All right.
I think the next question is, what about raw honey?
Yeah, so well, that's what I was saying. So the raw honey is what you want. The raw is a sort of incorrect definition. You know, it's really you're looking for all the honey should be raw. Like there's no such thing. If you heated the honey, it's no longer heated or pasteurized it with radiation. It loses most of the natural antimicrobial activity, and it still has caloric value, but not the value for microbiome, not the value as biologically active food, I would say. So that may be what we mean by raw. But raw still doesn't mean that it wasn't warmed up to a certain temperature to make it homogenized. So homogenized just, you know, I guess in America, people tend to like foods that look more presentable. So I'm not going to comment on that. This is not how I grew up. You know, we never had presentable foods. The foods were foods. You just eat no matter how it looks. But I guess times are changing. So my point being, when you're not heating up or homogenizing honey, it always looks a little uneven. And then it's quite, the more sugar content, the quicker it precipitates. So it starts forming layers at the bottom as it crystallizes. With heated honey, none of this is ever going to happen. So, you know, I don't know if I'm answering the question, but all right, let's see.
There's a question about Fluzone. If there's a senior that's already received Fluzone this fall, what would you recommend?
That's fine. No, that's fine. I mean, the comparison of Fluzone versus Fluad is very difficult. The fact that GW sided with Fluad doesn't mean a whole lot. They simply made that decision based on last year's results. That doesn't mean that this year, you know, we always we're always looking in the retrospect here and always potentially missing the best possible vaccine. I wouldn't worry if you got Fluzone, that's fine. I just told everybody that there is a sort of thinking backwards. For last year's Fluzone was very poor. That doesn't mean this year it's going to be the same. Not good. In fact, they probably made it better. Yeah, so Lee's correct. There is an assumption that all these deaths are unrelated, and also the neurological symptom is unrelated to the trials. But again, you know, I just give you an update of what I read at CNN, and the reality is it's very also possible we'll never know, because such data often is not publicly released until later, much later, as long as the trial board has approved to restart the trial without releasing the data for whatever the reason. But of course, this is very high stakes, so everything getting scrutinized so closely that all this data been constantly released, even though they may not explain what happened to that specific complication. So,
then there's a question about honeycomb in the honey jar. If it's included, does that mean it's not been heated?
No, not necessarily. I mean, there's different heating processes. Some of them, the wax will melt at pretty high temperature, so at boiling temperature. But usually, if you found the comb, it's not. It's probably sold from either a local beekeeper or a small manufacturer. There's not a lot of large commercial companies making the honeycomb honey, mostly because of the cost. It's not very sustainable for them to produce it because, you know, it's also the comb itself then has to be edible, or so to speak, edible, has to be approved to be edible. And that's not so easy to do for them because they're treating heavily most of the hives with chemicals, and the wax accumulates the chemicals. So that's one big point. When you're buying a comb containing honey, you always want to get it from producer that never use chemicals for any reason, because while honey can get cleaned some months after, the comb will not. Comb will keep all the residue of the chemicals for the entire rest of its life.
Great.
Right.
I think there's one last question. It's actually for me, asking me to comment on coconut oil versus or coconut cream in the diet as opposed to using dairy due to arthritis concerns. So I'm not opposed to coconut in the diet. You know, it's a great source of healthy nutrients. However, it is a saturated fat. And so you don't want too much saturated fat in your diet. So it's about ratio. Everything with fats is about ratios, right? Omega-6 isn't necessarily bad. It's about having less omega-6 in your diet than omega-3. The same is true for saturated and unsaturated. You want more unsaturated fat in your diet than saturated fat. And the way you know it's a saturated fat is because it's solid at room temperature. So anything that's solid at room temperature, lard, butter, coconut oil, those are all saturated fats. Anything that's liquid, like olive oil or grapeseed oil, those type of oils, even avocado oil, are unsaturated. So you want to have more of those in your diet than the saturated, and then you will be good. And I also say that I love using coconut oil for stir fries because it's a high heat oil, and that flavor is actually really good in the stir fry. So, you know, think about when you want to use it and how it fits in terms of the flavor profile.
There was also correction about Moderna, or some statement about Moderna vaccine. Let's see if I can find it.
There's another question here that Cecile's reposting. Thank you for doing that. Is it okay to put enriched honey in my hot tea, or should I just ingest it?
Yeah. No, of course it is, because, you know, it's a great question. If you warm up honey right before you consume it, that's fine, because, you know, it's too short of a period. What you don't want is, and plus, you know, when you put it in a tea, your tea is not sitting there boiling, right? It's probably close to drinking temperature. It's a little warm, so it's not an issue. You don't, when they commercially heat it, they heat it to relatively high temperature for a period of time. So that's what sort of inactivates a lot of biologically active molecules.
I think we should probably move on to Luann.
Yep. Sorry if we didn't answer something. If you guys feel like there's something unanswered, let's just start the new thread after Luann's talk and just repost it in the chat, because there's a lot of back and forth today. That's good.
Okay. Hi, everyone. Thanks, Dr. Kogan, Janet. And thanks so much for having me here today. I kind of have an admission to make. This has been a really hard week for me. 2 weeks ago, I was sick with fevers, and chills and aches. And I did get a COVID test, and it did come back at the beginning of the week negative. So I thought that was good news. But then suddenly my healthy 12-year-old cat got sick, went downhill, and was dead in 48 hours. We still don't know exactly what happened to him. But that suddenness of the death really caught Len, my husband, and I really unawares. And I was wondering what I could do today to kind of honor the place that I'm in, but also maybe some of you or many of you have been in this place before of feeling deep grief and not knowing really how to help yourself or what to do with it. So I have a great teacher, Paul Denniston, and he teaches a grief yoga class that's done from a seated position in a chair. So I thought what I would do is share with you today some positions to help yourself. If you or someone you know, you can show them how to do this. They're very simple. Janet has a handout for you, but I think by going through them together, it will give you some resources that you might need. I'm also very appreciative that all of you are going to do this with me today, because there is a power in our doing something in a group together. So thank you so much from the beginning. So the first step in the healing process is always awareness. Yoga's focus on the breath helps us to become present and to develop an awareness of what we are experiencing. You know, there are many different ways to experience grief. You can get angry, you can become very anxious, you can become depressed, you can feel shame about something. My husband got very agitated. He couldn't even sit still. He had to be outside. So you can become more aware of your critical mind and what it is expressing, and what kind of messages you're giving yourself, like I'm not enough, or I'm a failure, or I'm a bad parent. But when we bring the mind, body together, that will always help to lift our spirit. Awareness is also about feeling safe in the body. It creates a space for acceptance. Acceptance doesn't mean that we like the situation. Accepting the reality of what is will allow us to find more peace, more happiness, and more love. Awareness is also about addressing the problem and the pain of the problem. And it's about asking yourself, where am I stuck? Where am I angry? Where do I have fear or judgment? And becoming where in the body it might live. So we want to tap into those places of where we get stuck. Awareness can also enhance your intuition and can help you make a connection to what we call the inner teacher, your unique personal understanding of what will best serve you. One characteristic of grief is that we get rigid. We go into kind of a lockdown. And so that tension shuts us down. So we want to activate a sense of flow by beginning to connect to the breath, and then to move the spine. And some of our exercises that we'll experience will show you how to gently move your spine. Learning how to embrace movement and breath helps us to begin to find flow and creating that sense of safety, putting the power back in your hands instead of feeling so powerless. No. So we'll do 7 seated movements, combining with breath and sound, and then I'll lead us in a deeper meditation at the end. So we always begin with the breath. So first is to breathe in a count of 4 and exhale a count of 6. So if you would do this with me now. So we breathe in 1, 2, 3, 4, and exhale 6, 5, 4, 3, 2, 1. And again, breathing in a count of 4 and exhaling a count of 6. And again, breathing in And exhaling 6. And then if you will, bring your hands to your belly. I'm going to move to the chair so you can see me. So bring your hands to your belly and continuing the breathing, breathing in, a count of 4. And exhaling, a count of 6. And again. And just once more. And then gently moving your hands to your knees or your thighs. We're going to gently start to move the head and neck. And I mean really gently, tipping your head over to your shoulder, lifting, tipping it again to the other side, and lifting. And then if you want, you can gently roll the chin forward, and then to the side, and then back and up to neutral. And then once again, to the side, down to the chin. And then reverse that. Go to the other side, tip down, to the shoulder, back up, and once more. You can repeat that as many times as it feels good and comfortable to you. And if you notice any pain, just don't make too big a movement. Just do it very, very gently. Now we want to start to activate more of the spine. So I'm going to turn to the side, and we're going to bring our chest and our hearts forward as we breathe in, and then round the back as we exhale. Hands on the knees, bring the heart forward. And exhale, round the back. Once again, heart forward. Inhaling and exhaling, round the back. Don't know about you, but I felt some cracking going on in my back, and I've been doing this every day. So our next one is called the Sufi grind. This is for Misha. Hands on your knees again. And we're just going to move our heart and chest around while anchoring in the hips to the chair. Exhale, inhale, exhale, and come to center. The next one is to loosen up the jaw. And if you would like to unmute yourself for this, because we're going to do a clasping our hands, bending the elbows, and we're going to shake them and make some noise. So I'd like to hear everybody's noise because it's hopefully going to make us laugh a little bit. So we shake our hands and we also make a sound. Yeah, 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 Perfect. I love that. That was perfect. All right. So now once you start to feel a little looser and you start to noticing where you're feeling tight, is it in your spine? Is it in the neck and shoulders? If you're in your neck and shoulders and you know that's where you're carrying all this tension, you can close your fists in front of your heart. Inhale, bring your neck, shoulders together with the fists. And on the exhale, fists together in front of the heart, shoulders lift, inhale. Let it all. So you can mute yourselves again. Thank you so much. Our last one is going to be called dipping in to liquid grace. So we take our hands and there's a pool in front of us. We're dipping in. We're bringing up liquid grace. We're pouring it over ourselves. And then with our palms facing forward, we're washing away whatever it is that is bothering us. So let's do that a few times. Breathing in, dipping our fingers in liquid grace, pouring it into ourselves, and then gently washing away whatever is bothering us. Let's do that one more time. Dipping in. Now, if you would, bring your hands to your heart center and bring the image of someone you love deeply and care about. Maybe like you are missing someone in your life now. Or maybe we're just missing the people that we're used to getting together with, being with. And just hold them close. And allow your breath on the inhale and on the exhale to let go of any tension you're feeling anywhere in your body. But I'm going to give you a phrase today. It's called release your tension, but hold on to love. Release your tension, but hold on to love. And if you will, if you would make yourselves a little more comfortable, maybe lie down if you have that opportunity, or just get a little more comfortable in your chairs, in your seats. Close your eyes. And I'm going to be sending a loving Reiki blessing to you all today. I'll be telling you where I'm placing my hands on, but you don't need to move your hands. Just place them somewhere lovingly on your own body. If you start to feel warmth in your palms, as we're doing this together, feel free to send that loving energy out to anyone you would love to share it with. And so we begin. My hands I'm placing lovingly on your shoulders. bringing in this Reiki life energy blessing to support you in any way that you need support today. My hands are now moving, one hand to the top of your head and one hand over your heart. And I'm sending to you a loving Reiki energy blessing. My hands are now moving to your hips, where your torso meets your legs. Feeling that energy now flowing from the head and torso. Feel that light flowing through you and now into your hips and legs. My hands are now moving to your knees. Allow the light to fill your body. And my hands now move to your feet, blessing the earth. Now holding your left hand in my hands. Let all that love and light fill you up. And let it just roll down your arms and out your palms and out to anyone else who needs it. And now holding your left palm in my palms. Now I'm placing my hands once again over your heart. And then with a gentle sweep from the top of your head, slowly, slowly down the body, down the legs, to the feet. And once again, from the top, slowly, slowly down the body to the feet. Remember how powerful and how amazing you are. You are not your ego. Your loving energy is your connection to the universal life flow. And as we gently start to return, let me read the words of Carl Sagan For small creatures such as we, the vastness is bearable only through love. And bee poop. Thank you.
Thank you, Leanne. So Misha,
Thank you.
it's always hard to follow Luann, especially when she gives us such beautiful mind, body things to do to help us. And Luann, we are all sorry that you have lost a member of your family, because that's what our pets are. They're members of our family. Before we go, does anybody have any more questions?
We have a note in the chat from a yoga teacher, and she says, really beware of tipping the head back. That can harm your neck. Really pay attention to what you feel when you're doing any kind of exercise. So thank you. Thank you for pointing that out.
Okay. On that,
So I have a question.
okay, go ahead.
I'm sorry. Can you just buy the propolis from the beekeeper, or can you buy it in store, Whole Foods, or?
Yeah, you can get it. I actually suggest instead of getting it from beekeeper, the problem, beekeeper is probably gonna have the same issue as me. It's gonna look like a solid chunks. The problem, those are actually most pure, but the problem is it's hard to use that in a liquid solution for the neti pot.
Okay.
So I actually, there are lots of companies that make alcohol-based tinctures. So you can get them pretty much anywhere on any distributor or in Whole Foods probably. I don't know, I haven't checked Whole Foods, but I'm guessing you can get it there.
Thank you.
And one thing is when you're using it, if you're using it for topical applications, just be very aware of staining clothing. You're not going to wash it off. It's very sticky material.
Okay, thank you.
Mm-hmm.
Luann, would it be possible if you repeat the last two phrases from Carl Sagan, please?
You mean so you can get it from any, oh, that's for Luann.
Carl Sagan. Okay, so Carl Sagan's quote was, "For small creatures such as we, the vastness is bearable only through love."
Thank you. Thank you.
I have a question for Dr. Kogan. Is raw honey more healthy than regular honey?
Well, you should only be consuming raw honey, period. There shouldn't be any other honey consumption. Any other honey that's been pasteurized is basically pure sugar. That's my take on this. Once it loses most of biologic activity, you're just taking sugar in with not a lot of benefits. I mean, there's some honeys that will be pasteurized and still be okay for certain applications, but I don't really see any reason to pasteurize, heat, sterilize the honey. It's naturally can be, you know, they've done this finds where they found honey in a jar from ancient Egypt that were thousands of years old and it was still preserved and could be consumed. Honey, it's such a potent antimicrobial that nothing can grow in this if it's true honey. You know, if you leave the honey out and it goes bad, it means it's not a honey. And about 80% of all the honey sold in America is not a honey. It's a honey diluted with syrup. So it's a fake honey. And most of the large producers that make the fake honey, they don't even hide it. If you carefully read the labels, they'll say it's not true honey on them. Often those labels are not mandated. So if you buy a honey from any large maker, it's not a honey, period. It has to be from either very small boutique stores, backyard beekeepers, or there are a few international consortia that sells international honey, but most of it, even in places like Whole Foods, it's just not a real honey. So I unfortunately tell you that don't buy honey in large stores. You're not going to get anything decent.
So even the raw honey is not, you're saying that?
That doesn't mean, yeah, it doesn't really mean much of anything when they say,
Oh, okay.
You know, it may mean that they have not heated up or filtered, but if it's not starting from a true honey, and there's two ways the honey gets adulterated. One is when it's diluted with the syrup directly. That's everything that comes from China is diluted, 100%. And 90% of honey that is not from China is from China. What I'm saying is that they fake the labels. You can read about this. It's all wide and open in public. The honey that does not come in China can still be fake because the bees can be fed sugar. It makes it into a relatively light, very liquidy and very minimally aromatous honey. So that's the second type of fake honey. In certain beekeeping, each of those fake honey has its own names, which doesn't really matter. But so buy the honey from your local beekeepers, co-ops, small stores, farm stands, whatever. Just if it's made by a local beekeeper, don't worry about being organic. You're going to get some traces of, of contaminants everywhere. I don't think the true organic honey is easy to get.
A lot of people talk about Manuka honey. What is the story on that?
Yeah, I kind of spoke about this earlier. I'm not sure.
I'm sorry, I missed it.
It's mostly commercial fakes. It's nonsense, basically. It's just a good quality honey. If you find a Manuka honey at the cost of $10 a pound, get it. Beyond that, it's just not worth it. It's just a good honey. It doesn't have any superb advantage over regular high quality honey. Most of the Manuka honey claims are fake. I've read several research studies. I've actually reviewed some research study, realizing how fake the research is on that honey. It just, it was commercialized by several makers running very poor organized clinical trials leading up to the situation where now we feel like Manuka honey is everything. And it's kind of sad because in reality, it's just a regular good honey. Why is it 5 times more pricey than any other honey? It's, it's not justified.
Thank you.
Mm-hmm. Thank you, Janet, for the post. That's a good one. I think it's the most recent one also. Well, with that, we'll see you all next Friday, right?